Hello, everyone, and welcome to Your Health, Your Vote New Hampshire, part of the Protect Our Care virtual bus tour. I'm John Simoes. I am the New Hampshire chair of Protect Our Care. We've got a really packed program today and some really thoughtful speakers with us. So before I introduce them, let me say that as we speak, New Hampshire, ballots for the November 3rd election are on their way to your town and city. And that's really important because this may be the most vital, the most life-changing election in our lifetimes because our healthcare is on the ballot. You know, as the coronavirus rages here in America and around the world, the Affordable Care Act is also in real trouble. And we can't forget that fact because its fate will come before the United States Supreme Court on November 10th. If the Affordable Care Act is struck down, more than 22 million Americans will lose their health care, and millions more will lose the protections that they have for pre-existing conditions, access to comprehensive coverage if they lose their jobs, and free access to vaccines, which will be very important, I believe, in the coming year. It's also important to note that right now, if you lose your job, you can go to the Affordable Care Act, even if it's not open enrollment, and get a plan. That would change it. It would change immediately. I'd like to take a moment just to pause and remind ourselves that we've lost more than 200,000 Americans to the coronavirus, including more than 430 right here in New Hampshire. Our healthcare is on the ballot this year, and we need to vote early by mail or early at your town hall, but we need to vote, and we need to vote as if our lives depend on it, because they do. I want to say thank you to Granite State Progress and the New Hampshire Medical Society for their help today in putting this call together. We're going to have time for questions and answers at the end, and there's a Q&A feature. You could also comment or ask questions on Facebook, and my colleague Rebecca will put those through to us. Well, I want to now introduce Congressman Chris Pappas, our representative for New Hampshire's 1st Congressional District. In Congress, Chris Pappas has focused on the issues that matter most to Granite Staters, including improving access to healthcare, lowering the high cost of prescription drugs, combating the addiction epidemic that has taken such a high toll in our state, and protecting our environment and our drinking water. I know we're glad that he's here today, but I can personally say I'm also glad that he's fighting it for us in Washington, D.C. I believe Congressman Pappas is on the phone line and calling in. Congressman Pappas, are you there?
Hi, John. Can you hear me?
Yes. Hello. I hear you. Welcome.
Oh, great. Hi. It's great to be with you. And sorry I couldn't join by video. I'm in between votes here in Washington, so I just had to walk out of the Capitol. But really appreciate the opportunity to join you all, to join so many great advocates that not only helped pass the landmark law, the Affordable Care Act, but helped save it a few years ago, and I think are going to help safeguard it well into the future. We know that this is an important law because it provides essential coverage for every American. It ensures that healthcare is more affordable, that it's more accessible. And what we can't afford to have happen is this political effort that's been underway for years to succeed, especially now in the middle of a pandemic. So we're fighting as hard as we can to not only protect the Affordable Care Act, but be able to build on it. In the House, we've empowered our House counsel to be able to defend the Affordable Care Act in court. We've passed major legislation to protect people with pre-existing conditions. Over 500,000 Granite Staters have a pre-existing condition, and we know that we can't allow insurance companies to be able to discriminate against them. We've got to make sure they get the health care that they need. And I think what we've learned during this pandemic is that our health and well-being is all interconnected. And if we're going to move forward as a country, if we're going to do all we can to save lives, to improve health outcomes, to ensure that people get the right care at the right time, it's important that everyone is covered. And we know that we've taken significant steps forward as a result of the Affordable Care Act being the law of the land. And we've got more work to do to make sure that individuals can access coverage and that it's affordable. So I'm really looking forward to continuing this important work. I think we shouldn't be allowing people to use our healthcare as a political football. And we shouldn't be allowing people, including politicians and candidates, to be dividing us at this important time where we all know the health, well-being, and safety of the American people has got to be paramount. I've got a long history of working on these issues. When I was an executive counselor at the State House, I fought to implement Medicaid expansion. That is one of the best tools we have to fight the opioid epidemic in our state because it ensures coverage for substance use disorder. We've seen more than 60,000 Granite Staters get access to health care as a result of expanded Medicaid, but that could all go away if the Affordable Care Act goes away. And we know that with respect to our seniors in particular, it's really important that we avoid, a penalty known as the age tax from going into effect if the Affordable Care Act is invalidated in court or is repealed. Our seniors would see their healthcare premiums rise by about 66%, and they pay more out of pocket for prescription drugs as well to the changes under Medicare that would be brought about. So people across our state, across our country can't afford this political effort to succeed, to destroy the Affordable Care Act and to rip away healthcare from tens of millions of Americans. And we've got to keep up this fight. And this election in November is one crucial way that we can render a verdict on how we can move forward together and improve outcomes and make sure we're protecting the health and safety of all Granite Staters and all Americans. So I look forward to continuing this conversation over the coming weeks, and I hope we can see a strong result in November that will allow us to make progress for the American people on the important and central issue of healthcare. So I'll turn it back over to you, Jaime, and I want to thank everyone else for jumping on the call.
Thank you, Congressman Pappas. It's always a pleasure to hear from you. Next, I want to introduce Mackenzie St. Germain, who works with Senator Jeanne Shaheen, will give us remarks from the senator. I don't have to tell you that Jeanne Shaheen is a tireless voice for New Hampshire and has been for many years. She has fought time and time again for our health care to keep us safe, to keep us protected. And we're very glad that she's in Washington to represent us. Mackenzie.
Great, thank you. And the senator wished she could be here with everyone today, but unfortunately is tied up in DC. So I will have a letter from her that I will be reading. So hi everyone, my name is Mackenzie St. Germain. I'm Senator Shaheen's political director. I'll be reading remarks from the senator today. Hello everyone, and thank you Protect Our Care and Jaime for hosting this important conversation on the stakes of healthcare in this upcoming election. We're all here today because we're in the middle of a pandemic that's wreaking havoc on our healthcare system, our economy, and much of our daily lives. And 1 week after the election, the Supreme Court will hear oral arguments on President Donald Trump's lawsuit to overturn the Affordable Care Act and cut healthcare protections for more than 500,000 Granite Staters with pre-existing conditions. This election is about protecting the healthcare coverage that keeps millions of Americans safe and healthy, and we must make sure that Granite Staters and Americans understand how high the stakes are this fall. It's incredible that in the middle of a pandemic, Donald Trump and national Republicans are suing to take away Americans' healthcare without any real replacement to keep people safe. Repealing the ACA could kick over 100,000 Granite Staters off their healthcare plans. It could end Medicaid expansion and jeopardize the healthcare of nearly 60,000 Granite Staters who depend on it, including those struggling with substance use disorder. And it could threaten coverage for 572,000 Granite Staters with pre-existing conditions like asthma and diabetes. Now, in 2017, when President Trump and congressional Republicans tried to repeal the ACA through legislation, we rose up to stop them. Republicans had a very narrow majority in the US Senate, and thousands of Americans flooded their senators' phones, their main streets, and came to Washington so they could keep their health care. And it worked. We succeeded and narrowly defeated their efforts to repeal the ACA by just one vote. But that wasn't the end of this fight. No, Donald Trump and Republicans have made it clear that they will work to dismantle the health care law no matter what. And now they're working to overturn the healthcare coverage through the courts. Eliminating the ACA threatens our healthcare coverage, and it will raise costs. With the death of Ruth Bader Ginsburg, who was a champion for women and all Americans, the president is now vowing to add a right-wing Supreme Court justice that could take away all of our healthcare. We don't know what's going to happen with the Supreme Court case. We do know that if Trump and Republicans are reelected in November, they'll continue to chip away our healthcare no matter what. The only way to truly protect our healthcare is by taking back the White House and the Senate. In 2016, New Hampshire elected Maggie Hassan to the Senate by just 1,017 votes. Then in 2017, we were able to save healthcare in the US Senate by just one vote. A Democratic majority in the Senate runs through New Hampshire, and I will always fight to protect our care. Thank you for being here today and continuing to tell your stories. Let's continue to highlight why this matters so that Granite Staters in every community understand the stakes for healthcare in this election.
Thank you, Mackenzie, and please give our best wishes to Senator Shaheen.
Thank you.
Next, we are privileged to have join us a woman who is not a Granite Stater, but we'll say she is an honorary one. I'm talking about Kristin Urquiza. You may have remember her from speaking during the Democratic National Convention. I know that her words moved me tremendously, but if you didn't catch her speech, it was passionate. Her father, Mark, died of COVID in June, and he paid with his life by putting his trust in our presidents repeatedly saying that this pandemic would simply go away. She reminded me that coronavirus is there for everybody, but the world that Donald Trump lives in and the world that the rest of us live in sometimes are very different. And I'd like to ask her to share some thoughts with us, please.
Thank you for that introduction, and it's great to be here. I lived in Massachusetts for a while, so New Hampshire was a place I would often vacation to and spend time in the mountains. But I'm here to talk about what's at stake this election season. It is our basic health. This issue has become so real for me and my community over the course of this pandemic. As we just heard, my dad, an otherwise healthy 65-year-old, became ill with the coronavirus on June 11th and died 19 days later on June 30th. He was a Trump supporter who believed in both the president and his home state governor, Doug Ducey, when they said that we were on the other side of the crisis, that it was okay to resume normal activities. And with that, my dad ended up paying with his life. And still today, the president has failed to protect Americans, to do his basic job of ensuring that he puts people over his own wishes and his own party. On the coronavirus, he refused to take decisive action early on to mitigate risk, create a clear, coordinated, data-driven national response to the pandemic, creating the conditions today in which this week we have surpassed this grim number of 200,000 Americans dead. That is 20% of the entire coronavirus deaths in the world, and we only represent 4% of the world's population. That is profound. These consequences have been disastrous. And instead of doing his job, Donald Trump continues to downplay the virus, to bring people together for super spreader campaign events, and say, this past week that it affects virtually nobody. Those 200,000 people who died, my dad, the people that have passed in New Hampshire, they were not nobodies. They were people whose lives mattered. And because of the president's decision, their lives were cut short. Now, make no mistake, if we do not replace the president this November, we will not have the response to the pandemic that we need. We will not recover from this economic downfall in a way that ensures that people in the state of New Hampshire can continue to thrive economically. And we will lose more unnecessary, we'll have more unnecessary deaths. So that's why I am here today to share with you not only my story, but also the urgent need for us to replace Donald Trump and recognize that healthcare and our overall health is on the ballot this November. Thank you.
Thank you very much, Kristin. It's good to hear from you, and thank you for joining us today. And thank you for sharing your story. It's a difficult one. So I believe we have Andrew Slavic with us today. You may not know his name, but you should. He's one of the people who brought us the Affordable Care Act. He's a former acting administrator for the Center for Medicare and Medicaid Services, or CMS, and he led the team that helped roll out the exchange and helped make life better for 20 plus million Americans who signed up for coverage. He knows what's on the line, and he knows how much we stand to lose this November. And so I'd like to ask him to speak to us now.
Jime, this is Rebecca. Andy is unable to join us at this moment. He might be able to join later, but is not on right now.
Okay, well, that was a great introduction. Moving right along, I apologize. So our next guest is Dr. Marie Ramos. She is a family physician and activist with almost a decade of experience in practicing full-scope family medicine with obstetrics in Nashua, New Hampshire. She's the current medical director for the Gatehouse Treatment Center, and she is charged with developing and integrating a primary model for adults with substance use disorder. You know, she focuses her passion on promoting health equity as a national speaker, and it's really great to have her share her perspective with us today. Dr. Ramos.
Thank you, Jime. I'm so excited to share some of my patients' perspectives on the importance of the Affordable Care Act. You know, as a family doctor that's worked in both a rural and an urban setting, and as a woman who has grown up in New Hampshire, I know firsthand what it feels like to not have the opportunity to be exposed to healthcare and to have a full potential to wellness. Listen, you know, wellness and health should not be a political issue. We in the United States spend the most money in the entire Western world on healthcare, but we have some of the worst metrics. I've had to tell patients firsthand that their loved ones has died because they weren't unable to get medications for their chronic diseases. I've had to tell firsthand women who were unable to get mammograms and unable to detect their breast cancer early on because they were unable to get it as a result of not having insurance prior to the Affordable Care Act. I had to tell women who wanted to get birth control but could not afford it that there were no opportunities for them at that time, and they had to go without. I've had men die of colon cancer because they were unable to get the colon screening needed in their demographics because they lacked insurance for a pre-existing condition. This is the world that we lived in before the Affordable Care Act. My patients in rural California, where I worked in, and our patients in rural New Hampshire now, they have real issues that we need to address as a community. And the only way that we can do it is not to step backwards and to eradicate a plan that has helped bring steps forward in order for us to make some kind of leverage in our healthcare delivery system. The way that we move forward and progress as a nation is to hold on tight to what we have now and to make it better. I want to make myself clear. As a physician who takes care of patients from underserved populations who will have pre-existing conditions after this coronavirus epidemic finishes, I am terrified. I'm terrified at the notion that there may not be an Affordable Care Act available so that these patients that have lived and survived coronavirus to continue to live a life and to pursue wellness. We are all in the same direction. We all have the right to achieve the best form of ourselves as defined by WHO. And I want to make clear that healthcare should not be a political issue. Health is a right. I want to thank everybody for being here on this call. It is so important to get out and to vote because, as we've said, our lives and the lives of our children depend on it. Thank you.
Thank you, Dr. Ramos. Thank you for joining us. I'm also excited about our next speaker. I read about her recently in a newspaper, and her story is very inspirational. I'm talking about Lena Revis. I'm going to get that right. I knew I was going to. I got it right. She's She's our friend and she's our neighbor, and she's in long-term recovery from substance use disorder. She is right now gone on to not only to be in recovery, but help others. She's a project manager for peer recovery and support services, facilitating organization at Harbor Care in Nashua, New Hampshire. She's part of a team that's responsible for building, developing, and sustaining 17 recovery community centers throughout our state. Thank you for joining us, and please share your story.
Oh, thank you for having me. So I was so fortunate to find a recovery center called SOS in the Seacoast area. They literally saved my life. They provided meetings, they provided support, and they provided resources for me. SOS gave me job skills, confidence, helped me find a voice. They educated me. I was available to get my CRSW through SOS in their education programs, and be able to provide services and support for people who are just like me. Recovery centers can become sustainable by being able to build Medicaid. Many of the members that I worked with, I could provide resources like treatment beds and therapy and primary care physicians because they were eligible for Medicaid through the Medicaid expansion program. Through this pandemic, isolation is very, very common. I mean, we're told to stay home and not be around a lot of people. But for people like me, someone with substance use disorder, isolation is a death sentence in a lot of ways. Through this corona pandemic, unfortunately, there's been an increase in overdoses. And so these services that are paid for through Medicaid are life-saving services. Medicaid expansion is not just important, it's vital to keep these places open. Without SOS and their doors, I don't know where my story would have led me. I've been so fortunate to take the education from these recovery centers and move on with my career and be able to work with Harbor Care. And it's a blessing every single day that I get to go to work and help build programs and sustain these programs through all these different recovery centers all over the state. Recovery not only saved my life, but it gave me a purpose and a passion to do the same thing for others. To be able to walk through hell of active addiction and come out the other side and sit with someone and be able to be empathetic and compassionate is something that I'm so grateful for that every day. And without Medicaid expansion, these centers might not be around for very long. So this is a very, very personal fight for me. And I am so thankful that I got a chance to come here and share my story. Thank you.
Thank you. Thank you for joining us, and thank you for sharing. And all of you, I think you frame what's at stake on November 3rd. So thank you. I want to now introduce Carrie Duran. She has an interesting and inspirational story too, and I think one that rings true with many Granite Staters. She's a single mom from Wolfboro. She has 3 daughters, and her youngest experiences Down syndrome. Due to her caregiving needs, Carrie has worked part-time in positions, but none have offered her health care. She's currently on Medicaid expansion, and she can speak to how having Medicaid expansion has supported her and provided a safety net for her and her family. And you're looking at one of the faces of one of our neighbors in Granite Staters who could lose all of her healthcare coverage should the Supreme Court pull down the Affordable Care Act. So Carrie, thank you for joining us, and thank you for telling us your story.
Of course, my pleasure. I'm really excited to be here today. And frankly, after listening to everyone's stories, I'm feeling a little bit emotional because it is truly hitting home what's at stake come the November election. I have been fortunate enough to be a recipient of Medicaid expansion for several years now. I was able to testify at the State House in Concord as to the importance of Medicaid expansion to my family. Being a single mom of 3 girls, I have twins who just started high school, and my 9-year-old daughter, Katie, experiences Down syndrome. I haven't been able to have a typical full-time position because of being a caregiver for my daughter. She has many medical issues related to Down syndrome, and I have to be available to be able to take her to her appointments, to Mass General and down to Boston and up to Dartmouth and just all over. So I became my own advocate when I realized I needed to have a wellness exam for myself. I needed to take care of myself as a mom. I need to be healthy for my children. And I realized I couldn't afford to go. And that's when Medicaid expansion became really important in a very personal way. And I am so thankful to be able to have it now. To share, I just went this week to my first appointment since COVID-19 for my wellness checkup, and I feel so grateful just to be able to go to the doctor so that I can make sure I'm staying healthy for my girls. And I think what Washington has to understand is that, you know, I'm a mom, I'm a single parent, I work part-time, I am the face of many families in New Hampshire that are just trying to get by, just trying to take care of our families. And all we are asking is the ability to stay healthy. If I'm not healthy and around for my children, who is caring for them? So this is very important, very hits really home for me and for many Granite Staters. And I just urge those who are watching the call today, who might see it in the future, please take this seriously, vote in November, and ensure that our health care is taken care of so that we can continue taking care of our families. Thank you so much.
Thank you, Carrie. We're going to then pivot into answering any questions that folks have. They can be put in through Facebook, if you're watching on Facebook, or using the Q&A feature here on Zoom. I want to thank everybody who's been on the call. First, Congressman Pappas, Senator Shaheen, Kristin, Carrie, Lena, Dr. Ramos. Thank you for sharing your stories. You know, it's not easy to go on camera and talk about what's going on in your life, what you've seen, what you've experienced, what you've lost, and what you can lose. But I think with your candor and your openness, we should all remember that there's a lot on the line on November 3rd. It's important to be able to exercise our constitutional right and vote, but don't vote against anything. Vote for something. Vote for your health care. Vote for health care for your neighbors, your friends, people who live down the block from you you haven't met, you know, for your grandparents, your kids. The Affordable Care Act is a wonderful thing. You know, it has its blemishes, but it has given more than 20 million Americans access to healthcare, many for the first time. And the truth is, and this is the sad truth, there is nothing on the table. There is no plan on the docket to replace it. Absolutely nothing. And we're in the midst of a crisis where more than 7 million Americans have become infected with a disease that not only can be deadly, but leaves scarring long-term effects in people for the rest of their lives that we're just now starting to understand. And while there may not be a cure, there could be a vaccine. We can never forget that under the Affordable Care Act, preventive care, vaccinations, screenings are included and at no cost to those who are insured. And if we lose that, we lose our ability to vaccinate a large member of the population, a large portion of our population, and overcome this. So thank you. Thank you all for joining us. Thank you for sharing. And we really appreciate it. On behalf of Protect Our Care, I want to thank our partners at Granite State Progress and the Hampshire Medical Society. I will now ask my colleague, Rebecca, do we have questions? And if so, for whom?
Yeah, we have one question from Andrew Sylvia. of Manchester Inklink. His question for any of the panelists is, why do you believe many Republicans are opposed to the ACA and many are opposed to safety measures related to COVID-19?
Anybody want to answer, please feel free to jump in.
Sure, Jaime, I can speak to that. That's a great question. That's very insightful. I think part of the issue that we come across, especially over the last, several years, is this polarization and politicizing of science. And what we do know is that um, having access and quality access to healthcare reduces costs. What we do know is that the vast majority of people in the United States that benefit from the ACA are actually living in rural areas that are mostly Republican, and they're mostly white as well. However, I think that the narrative that is pushed at times is a different demographic and otherism. What we need to get back to, and what we need to understand as Americans, is that our health and our wellness improves our economy. And I think that resonates for everybody. If we have well workers, then we are able to be more productive and we can have a sustainable living. And so I think that if we can steer away from politicizing agendas and look at the numbers for what they are, we would see that it makes sense to highlight and to prioritize primary care and prevention for Americans. And if we can do that, then I think we would make huge strides.
Thank you. Anybody want to add anything else? I'll just point out the irony of the fact that when President Barack Obama's administration brought out the Affordable Care Act, it was essentially based on a Republican plan where you have private health insurance and people access to existing healthcare networks. It was a Republican plan from the 1990s. It was not initially a Democratic plan. And so, ironically, when it went first to the House and to the Senate, no Republicans voted to support it. It wasn't until it was in danger of being pulled down a few years ago by President Trump that a few courageous Republicans like John McCain, stepped forward and gave that thumbs down and kept it the law of the land, while others like John Roberts on the Supreme Court, our Chief Justice, voted to keep it in place. It is now very much in danger because the Supreme Court balance is shifting, and it's hard to say how it's going to go on November 10th when the case is heard. But a lot of people's lives, like Carrie, are in the balance. Any other questions, Rebecca?
Oh, it looks like that was our final question for today.
Well, great. We'll give folks just one last chance. If you have a question, to type it into the Q&A. Oh, wait, we do have a question. I think it's from a follow-up from Andrew. Do you want to read that, Rebecca?
I am not seeing that. I think we.
He says, for Dr. Ramos, you reference healthcare as a right. Did you mean you see it as a public good compared to education, police, etc., or should it be seen in the same way and paid for in the same way rather than through private insurance mechanisms in the Affordable Care Act? Does that make sense, Dr. Ramos?
Definitely, and that's a great question. Thanks for asking, Andrew. It's not just my opinion. The American Academy of Family Physicians has been a very staunch advocate for healthcare and having access to some form of universal healthcare as a necessity. And because it works, we in America have different demographics compared to our European and counterparts and our neighbors up north. So how that is done, whether it's a pluralistic form, whether it's Medicare for all, whether it's a single payer system, definitely that needs to be nuanced. But what we do know is that when we have access and we have equitable access, that it reduces costs, it improves health and wellness, and we are overall better. So I don't have a direct proposal because that's a very complicated question in our society. But what we do know is that the lot of the advance that we've made through the Affordable Care Act already has shown its measured success, and we can continue to build on that.
Thank you. And I think we can all agree that the road that we were on 10 years ago before the Affordable Care Act became law was not sustainable. Many Americans, millions, couldn't afford healthcare coverage. And the plans that sometimes they could afford were catastrophic plans that only kicked in after they had spent their entire life savings. And then they would get some sort of coverage. You know, we're very proud of our country. I know we all are. But to say that we can't afford to take care of people in a way that keeps them healthy, that keeps them engaged, that keeps them productive parts of society, I don't think that's an acceptable paradigm to take. And I think that, again, looking at the election November 3rd, we have a choice. We have a choice between the Affordable Care Act, which right now is keeping millions of Americans safe and protected and keeping healthcare accessible and attainable, and absolutely nothing. So it's a pretty clear choice. So it's something that we need to look at very carefully. But, you know, vote for your own best self-interest. Think about it. Again, don't vote against something. Vote for yourself, your health, your safety. It and many other things are on the ballot. That said, Rebecca, do we have any final questions?
No, that's it.
Well, I feel like the teacher who can say you can get out of class a little bit early today, folks, and maybe catch a ball game. No, thank you all very much for joining us. This has been a very productive 40 minutes. Some really good discussion. I know I've got stuff to think about. And so thank you so much for sharing. I'm John Simoes. This has been Protect Our Care New Hampshire and Protect Our Care's national bus tour. Your vote counts. So please don't give it up. Vote on November 3rd and vote like your life depends on it. My friends, it really does. Thank you very much. Thank you all. It's been a pleasure.